Today we're speaking with Dr. Kareem Sobky, board-certified orthopedic surgeon with Ortho1 at Presbyterian St. Luke's Medical Center. He's discussing total shoulder and reverse shoulder replacement surgeries. So Dr. Sobky, what types of services does Ortho1 at PSL provide?
Well, I'm extremely excited to be part of Ortho1 at Presbyterian St. Luke's Medical Center. This is a new branding, and we're super excited about it. To date, the services orthopedic-wise at Presbyterian St. Luke's have really been focused on complex limb-saving surgeries. We call that limb salvage. It is extremely complicated surgeries that require a lot of very atypical treatments, and we're experts at it here. We're now announcing new service lines at Ortho1 at Presbyterian St. Luke's Medical Center. We're going to be offering a joint replacement service line and a sports medicine service line. For joint replacements, both Dr. Tuttle and I are going to be offering anterior hip replacement surgery, which we both have about 10 years each of experience on. We're going to be offering computer-navigated knee replacements, press-fit or cement-free knee replacement surgery, partial knee replacement surgery, and for the sports line, I'll be offering shoulder replacement surgery, which we'll be talking about. But in addition to that, knee and shoulder reconstructive arthroscopic or scope type surgeries for all of our sports injuries. In addition, we'll be offering a new line of fracture care as well for for fractures that require surgery. So I think I'd like to talk to you about shoulder replacement today. So let's talk about what we do shoulder replacements for and why. Replacement surgery overall is done for arthritis. And what arthritis is when the smooth surfaces of a joint wear out. So for example, when you're at the store and you buy a chicken leg, it's the white shiny stuff on the end of that chicken leg, that's called cartilage. Unfortunately, that stuff wears out over time, and in some people wears out quickly and can cause pain and limitations of function. This acrylic model demonstrates somebody with arthritis, and this would be the ball and socket of the ball and socket joint that makes up the shoulder. And this model really demonstrates that the smooth area is all worn down and even gets down to bleeding bone. Same thing on the socket side, and that causes pain and limitations. When we talk about the treatment for this, well, we want to replace these rough surfaces. And how we do that is we remove a portion of that bone, usually just that much, and we replace that with a metal implant that goes down into the bone, and this is made of a substance that the bone grows into, and then we put a new surface on there that is typically made of a very smooth, shiny metal surface. And then for the socket part, again, that we would smooth and grind out, and we would end up putting in a plastic. This is really called polyethylene. It's very strong, lasts a long time, and is extremely smooth. And by doing that, that relieves pain and improves function. We do this type of implant. This is called an anatomic shoulder replacement. And I'd like to tell you why we do an anatomic replacement. And this drawing helps illustrate this. Is we have a ball and a socket, and in between that would be the cartilage surface, which is worn out. Above that ball and socket, which is highlighted in red here, are muscles which power the shoulder, called the rotator cuff. To do an anatomic replacement, the rotator cuff must be healthy and must be good. And so we choose this device when we have a good rotator cuff. And this is a wonderful surgery with a lot of improvement in pain relief and function. So I'd like to tell you now about another type of surgery that we do for shoulder arthritis. And for this, I want to start with this illustration. So we can also get arthritis between the ball and socket, but have a big tear of that rotator cuff where it is no longer attached. And this really limits function and causes pain. What happens here is this allows the ball to migrate up top and rub against the shoulder blade. And that really gives people a very weak shoulder in some cases, shoulder that they can't even lift. This is very painful. We tend to see this problem in our over 60-year-old population. What we do for that is we have to bring that space back down. And so we use a device called a reverse shoulder replacement. And what we're reversing here on this model shows it is we're attaching a new ball to the existing socket. And then we attach a new socket where the old ball was, again with implants that biologically grow, or the bone biologically grows into them. And those snap together like that. And when they snap together, that space is maintained open, which allows for motion and strength and really increased function. This is one of my favorite surgeries because people do wonderfully from it. But we have to do the right surgery for the right problem.
So, Dr. Sobky, what can a patient expect during recovery? Can they resume normal activities?
Right. So the beauty of these surgeries, both of these, is they really improve function. Many patients who come to see me with either arthritis and a good rotator cuff or arthritis with a bad rotator cuff, they lose motion, they lose the ability to reach, carry, push, pull, play tennis, play golf, ride their bikes, do things that they enjoy, and these surgeries absolutely restore that to a very high degree. We can't reverse time and make the shoulder like it was when they were 18 years old, but we can definitely make it really, really functional and much less painful.
And do you have any advice for patients?
Well, I think that if you're losing shoulder motion, if your shoulder is starting to keep you up at night, if you're losing strength, those are things that we want to see you for. We won't know if you have arthritis or if you have this combination of arthritis and rotator cuff tearing until you're really evaluated properly. These do require significant recovery and usually a one-night stay in the hospital, although some patients may be able to go home the same day. But when you lose a lot of function, your shoulder will tell you if it needs to come in to see someone like me.
Dr. Sobky, thank you so much. For more information, you can visit www.ortho1denver.com or you can call 303-837-0072. Thank you.
Thank you.